So today I'm going to be presenting my M&M. And last week we had a 35-year-old G3 P2 that presented with uterine abruption, placental abruption, sorry. And so we ended up taking her for an emergency low transient cesarean section because of not reassuring fetal heart tones. And yes.
Yes.
How old is your patient?
She was 35.
Is she pregnant?
Yeah, she was 37 weeks.
And was she bleeding?
Yeah, she presented with placental abruption.
Oh, okay.
So we ended up doing an emergency C-section, and estimated blood loss was 6 liters because the patient because there was uterine atony.
Sorry, Dr. Gore, can you repeat the objectives of this study?
Well, we're not really talking about research, we're talking about M&Ms right now. But I will present at the end of my presentation that we are considering turning this into a retrospective research project. Yeah.
Dr. Gore, are you aware of what the largest blood transfusion on record is and what year that occurred?
I have no clue, but I would think maybe around 50 liters.
Now, it is the case that the amount of blood that we can transfuse is really endless as long as the patient is able to stay stable.
Oh, okay. All right. Well, I guess I'll have to read more. And she got about 6 units of packed platelets. And she got fresh frozen plasma. So anyhow, we're going to be doing a research project on blood products and blood estimate.
How many number of patients do you have so far?
Well, we were thinking about doing, like, for the past year, so we would have about 900 patients from that.
Let's see.
Do you think that's enough?
Well, I mean, the bottom line, and at the end of the day, when you're looking at these studies, and if I was reviewing this study, I would definitely not even look at it. At the end of the day, you're going to need about 5,000 patients, to be honest.
Okay. Well, we could extend the study, I guess.
Actually, doctor, I was just in a meeting with the president of the Fertility Society of Chile, and they have instituted a policy in their entire hospital to prevent hemorrhage. So this could actually turn into a statewide policy if we communicate with the rest of the departments in the hospital. Maybe you can help her, and we can get this. We can actually get this going.
Was your patient bowel prep?
Yep.
We did not bowel prep our patient because it was an emergency surgery.
Okay.
Thank you. So the patient ended up getting about 6 units of packed red blood cells, and she got also about 12 liters of crystalloid.
Did you consider transfusing your patient?
Yes, we gave her 6 liters, or 6 units, I'm sorry. So as far as our research project goes, we are thinking about doing a retrospective analysis over the past year. So about 900 patients and evaluating.
What do you think your power is on this?
Well, we haven't done a power analysis yet, but we were just comparing it to other studies. Yes.
Are you aware of which study was the first study to ever do a power calculation?
No, I'm not. I don't know when that was.
It was actually in 1859. It was a study about tobacco smoking in rhesus monkeys.